For this video, I'm going to demonstrate the obstructive sleep apnea examination. So I'll start off by introducing myself. Hi, my name's Evan Graham. I'm with internal medicine, and if it's all right, I'll just demonstrate an OSCE exam on you. After that, I'll go to wash my hands, and then I'll make sure that the patient looks stable and doesn't need any kind of acute medical care, and then I'll go on to vital signs. In terms of vital signs, things that you can note is bradycardia, and this is caused by an increased vagal tone. You can see hypertension. Occasionally you can get tachypnea, and then rarely you can get hypoxemia as well, though this should not be during the day, and the finding of hypoxemia is more suggestive of some kind of additional respiratory issue, such as obstructive or obesity hyperventilation syndrome, or COPD. Additional thing that I would ask for is a BMI as well. BMI greater than 28 is additionally suggestive of OSA. Going on from there, I'll start off by just examining in the nasal, and what you'll look for is any kind of septal deviation, if there's any kind of nasal polyps, any signs of allergic rhinitis, and any turbinate hypertrophy, which I don't see. Then I'll examine in the oral pharynx. You can just open up. And what you're looking for is actually a crowded oral pharynx. So you can look for any kind of tonsillar or adenopathy, tonsillar hypertrophy. You can assess the Mallampati score. So Mallampati score goes from 1 to 4. 1 is where you can see the whole tonsillar pillars. 2 is there's obscuring of the tonsillar pillars, but you can still see the uvula. 3 is you can only see the base of the uvula, and 4 you can't see any of the uvula or the tonsillar pillars. Additionally, noting when you open up the mouth, you can see a elongated and flaccid soft palate. You can see a high arched palate. You can look for macroglossia, or an enlarged tongue, as well. You can close your mouth again. You can get them to just bite down for me. Perfect. And you can look for retrognathia, where there's an underbite. If that's greater than 2 millimeters, is a positive finding. And then you can look for micrognathia as well, or a small Hyomental space as well. So you can just measure this with a ruler from the hyo bone to the mental region. If that's less than 4 centimeters, that's a positive finding. You can also look for a small Crico-mental distance, or Crico-mental space. So you look for the cricoid cartilage to the mental bone. You just go there, and if that space is less than 15 millimeters, is a positive finding as well. The last thing you want to look for is just if there's an enlarged neck circumference. So just with a measuring tape, you can go around and measure the neck. Just like so. In females, a positive finding is greater than 40 centimeters, and in males, a positive finding is greater than 43 centimeters. And that concludes my obstructive sleep apnea exam.